A 65-year-old male, hospitalized for 5 days following abdominal surgery, presents with a fever of 101.5 degrees Fahrenheit, productive cough with purulent sputum, and dyspnea. He is currently intubated and mechanically ventilated in the intensive care unit. His oxygen saturation is 88% on 40% FiO2, and a chest X-ray demonstrates a new infiltrate in the right lower lobe. Hospital-acquired pneumonia, HAP, is defined as pneumonia developing 48 hours or more after hospital admission. This condition is characterized by clinical features such as fever, leukocytosis, purulent respiratory secretions, and the presence of a new or progressive pulmonary infiltrate on radiographic imaging. In patients receiving mechanical ventilation, this may evolve into ventilator-associated pneumonia, VAP, a subset of HAP with distinct diagnostic and management considerations. Key investigations include sputum culture and gram stain. These are essential for identifying the responsible organism and guiding antimicrobial therapy. Blood cultures. These are obtained to evaluate for systemic infection or bacteremia, particularly in severe cases. Oxygenation assessment, measurement of oxygen saturation and arterial blood gases, assesses disease severity, and guides supportive care. Chest imaging, a chest X-ray or computed tomography scan, confirms the presence of a new infiltrate, a hallmark of HAP. Antimicrobial therapy, early onset HAP, less than 5 days of hospitalization. For cases occurring within the first 5 days of admission, a third-generation cephalosporin, such as ceftriaxone, is typically adequate, targeting common pathogens like Streptococcus pneumonia and Haemophilus influenzae. Late-onset HAP, greater than 5 days. Or high-risk patients. Broader-spectrum empiric therapy is indicated due to the increased likelihood of multi-drug-resistant organisms. Recommended regimens include an anti-pseudomonal beta-lactam, e.g., piperacillin tazobactam, combined with vancomycin or linezolid to cover methicillin-resistant Staphylococcus aureus, MRSA. Therapy is subsequently adjusted based on culture and sensitivity results.